the Older Adults Home Modification Grant Program NOFA webinar. We're delighted you're joining us today. Our first speaker is going to be Ruth Ann Norton, our President and CEO, and then she'll introduce distinguished staff from HUD today that are joining us as well.
Well, thank you, Wes. And I see you're registered as Rebecca Jackson. So if anybody's confused, that's actually Wes Stewart on the screen there. And I want to thank our team for helping to put this on to our network. And I want to thank the U.S. Department of Housing and Urban Development for making really critically important money available as we think about the care of our seniors, the ability to allow people to age in place well and with health, and as an important factor in helping us to create intergenerational wealth transfer by allowing people to age in their homes and improve the value through health. GHHI, the Green and Healthy Homes Initiative itself, began working with older adults as part of our healthy housing portfolio now more than a decade ago, because we saw the intersection between the young children and families that we were serving and older adults in intergenerational households. But we also saw the important health impacts that we could make by home improvements for injury prevention, indoor air quality, and other health-based housing work. We've really concentrated much of our on-the-ground work in 4 distinct places. We are honored to be a part of the housing upgrade benefits for seniors with other co-leads in Baltimore, such as Civic Works, Neighborhood Housing Services, and Rebuilding Together, amongst many, and supported by the Weinberg Foundation. The HUBs program actually won the HUD Award for philanthropic cross-sector support a couple of years back. And we have been advancing that work here together as a collaborative with the city. In Memphis, Tennessee, we are part of the Habitat for Humanity of Greater Memphis Capable and Capable Plus work, where we are helping to do evaluation around that work that includes GHHI Memphis and our partners at Le Bonheur Hospital as well. In Cincinnati, we have worked with the people working cooperatively. We've actually written a great paper around age of place that came inspired out of that work. And then with Molina Healthcare, we've been working with the older adult services, as well as supporting GHHI sites around the country who have been advancing great work. So we're really glad to have you today as a network. We're super honored to have our partners at HUD who will talk about this new Notice of Funds Availability and provide an overview of that. They're also doing another webinar on April 4th. So if you don't get enough of the goodness today, tune in for that webinar. And you're going to hear from 3 incredible partners out from the Office of Lead Hazard Control and Healthy Housing, Dr. Peter Ashley, who's the Director of Policy and Standards Division, Yolanda Brown, who is the Program Division Director, and Karen Grego, who is the Healthy Homes Representative for Regions 9 and 10. And we're really delighted to have you all join us. Why don't you take it away from here? And then Michael and Wes will come back on the back end and we'll all be available for questions. Thank you again for joining us. Take it away, HUD. Anyone there?
Hi, Peter, if you'll unmute. You're currently on mute, Peter.
I'm sorry. I thought Yolanda was going to do this.
You want me to do this part, Pete?
I can go ahead. That's fine.
Okay.
Hi, everybody. Thank you, Ruth Ann. Sorry about the little technical difficulty here. Thanks for joining us today. This slide just shows a brief overview of what we're offering through this first time NOFA this year. 30 million in funding is available to experienced nonprofits, state and local governments, and public housing authorities for awards of up to 1.25 million. The range is, I believe it's 500,000 to 1.2 million in terms of the grant levels. And where these funds are being offered to help older adults age in place. These are older adult low-income homeowners, and the idea is to conduct home assessments. The NOFA requires the use of an occupational therapist for the home assessment, and identify interventions that will help the seniors age in place safely. So improving safety and functionality of the home environment. And the focus on functionality is the reason that we are requiring that grantees use an occupational therapist, because they are trained to assess the interaction between the adult and his or her home environment, and to identify interventions that will specifically improve the person's functionality in the home. So it's more than just improving safety and conducting or using physical interventions such as railings and grab bars in bathrooms, et cetera. There's a real client focus to these the assessment and interventions. At least half of the funds are to be awarded to grantees that serve communities that are considered substantially rural. This was language in our appropriations bill that accompanied these funds. And we have a tool that was developed for you to go in and identify whether your community is considered a substantially rural or an urban community. The other thing that's been causing some questions is about public housing agencies being eligible applicants. Again, that was written into the appropriations bill, and we'll talk a little bit more about that later. I don't want to take up too much time on this one slide. Thanks. So what can this grant do for you? Why should you consider it applying for the grant? This is, we think it's, pretty evident how this could help support seniors living in the community. I know there's there's concern about it being limited to homeowners. This again was not our decision. It was a congressional decision that they be focused on homeowners. There are already programs at HUD for supporting seniors in rental housing. So let's talk a little bit about the goals. The program furthers affordable and accessible housing goals by improving existing owner-occupied housing stock. And this is also important by having people age in place. It also reduces, if you look at it in the big picture, and reduce healthcare costs, societal healthcare costs. And the program is expected to demonstrate that providing these client-focused, low-cost interventions in the homes is feasible and beneficial. We've developed the NOFA or NOFO, I guess is our new terminology, based on research that showed what's worked, and the research has shown that targeting older adults who are a little bit more vulnerable, who maybe have had a history of falling in the past, will be the ones that are most benefited by this. There's other criteria too, like maybe reduced vision, balance problems, et cetera. So if you really try to focus on that population, we expect that the benefits will be magnified. And that just makes sense. You know, the people that are more vulnerable, that really need the help the most, are the ones you expect will benefit from these interventions. Now, this last box here on the right, it's funny, I'm not being able to see it because of the way that let me reduce that. Okay, here we go. So the intention is to create a funding opportunity to further support experienced applicants to address the needs of this population. And, you know, we always think this way, you know, federal agencies, we hope that in doing these and implementing these grants, that you will build sustainable aspects into your program. So once the grant money is gone, we hope to see that you can sustain some aspects of the program going into the future. So please also keep that in mind. Okay, that's it for me. Next, please.
Thanks, Peter. This is Mike with JHHI. I'm going to go through some of the highlights of the NOFA and then turn it over to Wes as well. As Peter said, it's the eligibility, county, city, state, townships, special district governments, 501c3 nonprofits, and public housing authorities. And we do have a question at the end, as Peter referenced. It's not eligible for-profit organizations or institutions of higher education or tribes for this particular NOFA. Around cost sharing or matching, there's no required cost sharing or matching with this. There is a program requirement that eligible applicants need to have at least 3 years of experience in providing these kinds of services to older adults. And as Peter said, you know, you have to designate sort of a target areas, either urban or rural, and HUD has provided a tool, Appendix A, to help sort of identify those areas. Again, in terms of the home modifications, as Peter said, the scope is basically generated by an occupational therapist. This program is designed for low-cost changes to the home environment that are directly related. So there is a cap. The cost is capped at $5,000. If the cost of a scope is above that capped amount, you need to get HUD approval. And there's also a requirement for grantees to publish sort of what is in scope and what is out scope in terms of home modifications. And I think that's very smart, just to make sure that the potential beneficiaries really understand what kind of home modifications we're talking about. It's very good when you talk about running a home mod program. And then for relocation, there is relocation if unless the work is being done exterior, or if the work is being done interior, that the work site is contained and there's no issues in terms of sort of hazards or safety issues. And then for disability grantees must comply with Section 504. Now, in terms of sort of the program model, and they clarify this in the NOFA. So yeah, you'd either have a licensed occupational therapist or a licensed OT assistant are the ones sort of doing the interview, assessing the home, and with the client's consent are sort of creating that scope for the home mods, including prioritizing what is necessary based on what the needs of that individual are. That scope is done by a licensed contractor. And then once the work is done, the OT will come back and conduct a follow-up assessment to make sure that the scope was carried out, but also to provide education, right, for that individual to make sure that they understand the modifications, if there's like equipment or device, how that's being used, sort of all of that. And then for the assessment, at least one standardized assessment tool needs to be used by the grantee. If there is sort of a change from this program sort of services model, then in your proposal, you need to provide justifications for why that change, for your individual program would be better than the sort of standard program services model as laid out in the NOFA. For a couple other things around sort of the services, one, the services that are being done, the home mods, don't replace, if you have a clinician ordering home care visits or anything like that, there may be ordered OT visits, right? So none of this takes the place of sort of what is the regular healthcare services that the individual will receive. The next item is around duplication, and HUD is very, very smart by putting this in. So basically, they said you need to avoid obvious duplication of Medicare or Medicaid benefits, like if there's a device that was already ordered by a clinician. But beyond that sort of obvious duplication, neither the grantee or the beneficiary is required to determine whether or not Medicare and Medicaid benefits exist for these services. And that's very smart because it's very tough to sort of figure out what is covered, in terms of Medicare benefits, Medicaid benefits. So that's why HUD is not sort of requiring all the grantees to become Medicaid and Medicare experts to deliver this program. In terms of sort of the contractors that would be doing these home mods, they're required to go through onboarding, be licensed, bonded, and insured. If work is being done on mobile homes or manufactured homes, you have to follow the state and local requirements there. And then all the home modifications need to have a warranty period for that work. And then, as sort of usual for HUD grantees, the grantees have to comply with the HUD-funded evaluations, collect data, and be able to share that data with HUD. A couple of other requirements, one around environmental review. The program, I think from the legislation, is designed to be sort of low barrier. And so the activities, and we'll go into this a little bit in detail, the activities should minimize the likelihood of environmental review. But if there is that requirement, then HUD will conduct that environmental review under 24 CFR Part 50. Some of the other things you have to respond to in your proposal is you have to have policies and plans in place to address the needs of vulnerable populations. You do have to attend the program manager school and training from HUD. There is a section around sustainability. So this is really sort of what are the plans in place, what's the strategy to make sure that post this grant period that these kinds of services and modifications can continue. And then a requirement that all the goods and services need to be competitively bid out. Going into the allowable costs, one, operating the program, so staff and contractor recruitment, salary, wages, and fringe, program marketing and advertising to the community, like printing materials, procuring materials and supplies for program administration that are under $5,000 are all allowable costs. Another category is around IT and IT services. So, maintaining a database, getting IT consulting services, those are allowable costs. Client intake, assessment. I did see in the chart, there's a question around paying for the OT services. So like that is an allowable cost, ensuring that the beneficiaries are eligible for this program and those costs associated with that. any fees that are associated with that standardized assessment tool, that's a requirement. If you do have a model that has sort of a social worker service or something like that, that is an allowable cost. Translation services, and then also developing sort of resources that go beyond the scope of this grant that your clients, your beneficiaries can draw on to get additional support. So developing that list is an allowable cost, and then anything around accommodation for disability, things like that. For the home modifications, it's allowable cost as long as this is part of that scope that's being put together by an OT or OT assistant. These can be adaptive equipment, materials, supplies, labor cost. There is that hard cap of $5,000 per unit. And also an allowable cost, any cost to making equipment accessible to certain populations. Another cost category is around professional development. So certification, training and aging in place or related areas, some travel, as long as there's a prior approval by HUD for training and conferences can be allowable. And then indirect costs, either your negotiated indirect cost rate or 10%. And then in terms of the funding restrictions, no purchase of property, purchase of equipment that's greater than $5,000, medical treatment, profit, coastal barriers, anything that's out of compliance with the Coastal Barrier Resources Act, or units that are in FEMA flood zones without flood insurance. And a couple of the other, so you'll see this list in the NOFA. There's a list of activities. And so HUD strongly encourages maintenance repair activities, which is the middle column. So I just cropped like basically an example, but you'll see in the NOFA there's sort of a pretty long list of the kinds of modifications that we're talking about. And so there's sort of two categories. There's the maintenance repair, which is in the middle. And then on the right, there's the rehabilitation repair. And basically the ones on the middle column are things that you don't need to, they probably don't need an environmental review. So, and we'll talk about this later on in the Q&A section. So things like repairing flooring, addressing transitions in floors, things like that fit in that middle column. Whereas like installation of a new floor is on that right column. So basically, sticking to the middle column are those services that you don't need environmental review for. But again, we'll talk about this a little bit later on. Just a reminder around beneficiaries. This is open to a beneficiary that's at least 62 years old with income requirements at or less than 80% area median income. It is for homeowners, so no rental housing units, as Peter said earlier. So at least basically one owner meets the age and income requirement and lives in the home as their primary residence if you have sort of multiple folks in the same home. But one key is that benefits are not multiplied. So if you have, let's say a couple where two adults live in the same home where they both meet the requirement of a beneficiary, you don't basically get double sort of the budget for home repairs. It's you still have that same cost per unit. And then there is additional criteria that could be allowed by the grantee based on like physical condition of the home, or if there's sort of been previous home modification benefits received under this grant program. And I'll turn it over to Wes.
Thanks, Michael. Michael covered a lot of the program requirements for this NOFA, and Dr. Ashley had talked about. I'm going to work and discuss some of the structure as you're planning your application, putting it together, things to be considering. This is for HUD's Office of Lead Hazard Control and Healthy Homes, and it's using the grants.gov system. So the first thing to do is to download from grants.gov the application package itself. There are a number of forms which are electronically embedded, but there's also forms you're going to specifically need to download, such as the 424 CBW budget application. But this is a list of the forms that will be necessary, but those are some of the first key steps to do that. And putting the package together itself, there's a one-page application, and there's also a 15-page narrative description. In addition to that, there's a number of forms that are required. Again, some of those are part of the Grants.gov application package you'll see when you open up that package. Others are going to be required for you to attach to your application through the Grants.gov system. But it's a one-page abstract. It's a 15-page narrative. As we'll talk about, what's really key is that you judiciously utilize your 15 pages. And so as we talk about each of the rating factor narratives, how you accomplish and get to those 100 points is really important in terms of how you utilize your pages, in terms of what factors get the most page length. Looking at some supporting materials, there's some key things to be aware of. A number of forms are required attachments. Those are things such as resumes, organizational chart, letters of commitment, verification that you're nonprofit in terms of bylaws, articles of incorporation, IRS determination letter. Those are things that are required to be attached, but don't count against your 15-page or your 10-page limit. So you have a one-page abstract, a 15-page narrative, and then you also have the ability, besides the required forms, to attach 10 pages of discretionary things. Those are typically going to be things about your organization experience, but also, for example, if you've had successful programs that have evaluation, you certainly want to show that not only are you doing this work for older communities, but you also have a demonstrated track record of actually producing results, producing outcomes and impact. So those are things to consider. So a lot of decision making in terms of strategic putting your application together. And looking at the last item on this is also the budget and the budget narrative. So as part of your 15 pages, you will have a budget description of your fiscal process, your fiscal planning, who's going to be providing oversight, but there's also a 4-page budget narrative you'll need to complete that is separate to those pages. So that's something that's very, very important for HUD to see what your costs are, what your justification for those costs, and also where your leveraging funding comes in as part of that budget narrative. And we'll talk in more detail. Next slide, please, Mike. So when you're crafting your narrative, understand that the reviewer, again, for a lot of folks who may be lead hazard reduction grantees, healthy homes grantees, one of our key things to stress is don't presume that the reviewer knows you. HUD has a very diligent, very highly professional staff who will be reviewing the applications, but don't presume that they know your program, your organization. It could be presented and provided the review by any staff member at HUD who's in the Office of Healthy. So just please don't presume that they know that. Make sure you actually diligently prepare your application to your organizational experience, your capacity, your ability. The reason that's important is HUD will be using a qualitative rating system. So each of the 3 primary factors, rating factors 1, 2, and 3, will be graded, as well as a smaller rating factor on section 3. But this is the scoring system that we use. So for example, factor 2 is worth 48 points. If you only scored 50% on that.
Hi, Mike, how are we handling questions?
You'd only get 24 of those points. Next slide, please.
Hello?
So looking at factor 1, and you're crafting your narrative description, there are 2 key positions that have to be named in addition to the other staff. And the first one is the program manager. That's really the linchpin position. That's someone who has experience ideally in working, certainly in housing intervention, but most ideally in terms of done work in terms of older homes, and have overseen a program that actually uses different assessment tools, has the ability to project manage, and also has the ability to produce unit production, which is really key for HUD to know, to have confidence in you. So in terms of your staffing, you'll have a project director who's a higher level person who will be more in terms of administrative partnerships, key stakeholders. But the program manager, the project manager is the day-to-day person who runs the program, has to be 50% on the project. In terms of your organizational experience, as Michael mentioned, you have to have 3 years, not only working with older populations, but also providing older adult home services in terms of home repair or remediation, home modification. So a number of things here are important to lay out in terms of your experience. Your partnerships, it's great to have partnerships. It's tremendous to bring that asset to the table. The one thing we have to give you a cautionary measure is Unfortunately, you can't spend 7 pages describing your tremendous partnership. You have to be judicious about how you do that. So if you want to lay out the history, you need to do that succinctly, but certainly include the great partners that you have. But again, you only have 15 pages to do so. In terms of sub-grantees and sub-recipients, HUD does allow you to name those. There will still have to be a competitive bidding process for parts of the work in terms of some of the home renovation to make sure the pricing is competitive, but you are able to name your sub-recipients and your sub-grantees. And so again, look at folks who have experience, so the reviewer is going to be able to quickly and readily have confidence in their ability to deliver what you're asking them to. The last piece is also in financial capacity. So this grant is a reimbursement grant, so you're not going to be getting funding up front to be able to go in and do interventions. So if you're a nonprofit in particular, you make sure this is something that you're able to do. You're able to front money and be reimbursed through the ELOC system by HUDs afterwards. And next slide, please. The bulk of the work plan in terms of what your program model is, what are those roles and responsibilities are going to be described in Factor 2. You first have to make a decision and determine, based on Appendix A and looking at, is it a rural jurisdiction? Is it an urban? Is it a mixed jurisdiction? And so HUD has a tool for you to do that in Appendix A, but that's really important because the funding is 50% designated for rural jurisdictions. And so that will be a key in terms of how many grants are going to be given out to those in urban and rural areas. As part of your program strategy, think about it in terms of the reviewer. They're going to want to know from client intake and referral, what's your recruitment, what's your pool of applicants that are going to be coming into the program, what type of assessment tool are you using, both for the adult client in doing their personal interview and also for the property. But you're going to need to determine, ideally in advance for this, what is the tool that you're using, and also who's going to perform that. Who is the OT? Where are they going to be housed, et cetera. But then also on the next steps of laying out for your workflow, who's going to be, you're going to use private contractors, in-house contractors, who's going to take that scope of work and complete, and then also who's going to be part of your evaluation team to look in terms of impact. But all the steps in terms of from intake to assessment to temporary relocation to intervention, thinking through that and making sure you can readily describe that where it flows for the reviewer. In terms of the beneficiaries, you do have to still describe the need, not only in terms of the target populations that Michael mentioned, but there's sufficient pool. So again, who are your referral sources? It's critical that HUD knows you're going to have sufficient number of applicants, a sufficient pool of clients to serve. That is really critical to be a successful applicant for this HUD funding. We talked some about the project director, program manager. What's always better is to have named personnel. So if you have staff who have experience, you have their resumes, it's always better that HUD knows a known quantity. If you don't have those positions filled, you can put a job description in there for the OT, for the program manager, project manager. The one restriction on the project manager is that person has to be hired, and you have to make a commitment to hire them within 60 days. So you're able to do the startup period and you hit the ground running with your grant. In terms of contractor capacity, as I mentioned, some people will have the ability to do that in-house. If you're doing that through local contractors, you have to also describe that there's capacity, there's experience, there's people who can fulfill the scopes that you have for home modification, home remediation work. And the last piece is on sustainability. HUD is seeding this model in a number of jurisdictions. We're all incredibly enthused that they're making this NOFA available, but they also want to see that through state funding, local funding, Medicaid, Medicare, healthcare partnerships, how are you going to sustain this after the grant and build on that? It's also important to have leverage funding. So even though there's not a match requirement, a successful applicant is going to bring leverage funding to address housing rehab and address larger scale home modifications. And there's also a timeline as part of this grant for the reviewer. Next slide, please. In terms of Factor 3, there are two key parts of the budget aspect. There is a budget narrative where you're describing in terms of fiscal oversight and financial, who is going to manage vendor relations, who's doing accounts payable, accounts receivable, who's making payments to sub-grantees and sub-recipients. But also HUD wants to make sure they have confidence in your ability to follow all the financial requirements. So 2 CFR 200 in terms of administrative and financial requirements, you have to be sure that you're cognizant of that, that you have the ability to manage the grant in conformance with the federal regulations and the program requirements as well. So that's really critical, that you get ELOCs drawdowns. You're not only performing quality services, but you're also billing and charging those services to HUD and making LOCs drawdowns. So again, all these things are important about your program model, the competency of your project management from beginning to the end, and including vendor payments and LOCs drawdowns. So key financial part there. In terms of the budget narrative, as we mentioned, it's really important for HUD to understand who is performing what functions with what agencies, and what is the HUD share. If you bring in other funding, such as leverage funding, what parts of your grant are being paid for in terms of personnel, fringe, supplies, materials, making it clear what is HUD share that you're proposing to use, and also what's going to be paid for leverage, but also justifying those costs in terms of how you arrived at the market price or how you relied on the supply costs. You have 4 pages to do that in your budget narrative. Those 3 factors make up 98 of the points. There are 2 additional sections to be aware of in your budgeting, your 15 pages. The last one is on section 3. Section 3 requirement is to utilize businesses and also community residents that are at or below 80% of AMI. That is really critically important. The new administration is recommitting to making that a priority from our understanding, and we fully support that. So one way to do that is actually to hire Section 3 personnel for your program, or to make sure the contractors are explicitly hiring and utilizing Section 3 residents as well to be part of your work plan. So that's really important. That's worth 2 points. And then the last piece is there are 2 preference, essentially bonus points, which are, is the project going to be conducted in an opportunity zone or a promise zone? To get those points, you must verify that and provide certification forms verifying that you don't get both. You can only be eligible for 2 points, but if the project is in an opportunity or a promise zone. Really important to make sure you have the paperwork there so you don't lose out on those 2 points. Next slide, please. The last part we want to talk before we get to questions answered, just some tips we've learned over the years, things we think are important just for you to be aware as you're planning to start your application, that you're putting that application together. These things are just good practices, but also things you need to be aware of. May 4th is giving you sufficient time to actually do planning and put together a quality application. But some of the administrative requirements you want to make sure, especially for nonprofits who are new to grants.gov, you're new to HUD and applying for these grants, you want to make sure you've gone in, that you're in the systems for award, the SAM system, that you have your DUNS number, but also you've gone into grants.gov and gotten yourself set up, that you've downloaded the application, you have workspaces, you've assigned the workspaces to all of your AORs, which are authorized representatives. But what is really important is even at the city, county, or state level, you also know who is applying. Is the city going to apply? Is the city housing going to apply? So making sure there's good communication early on as to who the applicant is, which DUNS number you, but also who's going to be the authorized representatives to actually prepare the package and submit. So those are things we recommend doing early. We talked some about selecting target areas. One thing we found is it's important not to be too restrictive that you don't have sufficient applicant pool. So target an area which has older adults, low income, meets your partner's criteria as well, but make sure that target area is large enough to be able to fulfill your needs for the grant. And the same thing with partners, who brings things to the table, who's going to be funded grantees, who's going to be providing their own match or leverage. It's also not too early to start collecting that data for the need. You're going to need to show that there's sufficient seniors, low income, socioeconomic factors, housing needs, et cetera. So start pulling that data, asking your partners to pull data in terms of how many patients, clients, members they have within their organization that you're going to actually serve. And the last piece is on cost that Michael talked about. You need to be able to have a good understanding of those costs as you prepare your budget. So identifying partners, also looking at who is bringing leverage and what are the needs, what are the unfunded things you see here that you're going to need to address, knowing your particular housing stock, that you need to bring in leverage resources. And I mentioned before, just again, for experienced grantees, you've been getting a lead hazard reduction grant for 20 years. This is a different NOFA. So again, don't presume that HUD is going to know exactly who you are and what your program model is for this adult services program. Next slide, please. One thing is to also look at your strengths. So again, you want to answer the NOFA, you want to make sure that you're completing all the questions, but also what are the assets that you bring? What makes you unique? Again, HUD's going to have a certain number of applicants to fund. And it's also important that you answer every question. Answer the questions in the order of the NOFA. Beautiful prose is not as critical. This is a technical proposal, so make sure you answer the questions thoroughly. Make sure you answer them in the order that they're asked. And again, don't leave points on the table by not answering certain questions. You have 15 pages of text to do that. So again, being deliberate about where you're using, section 3 is only worth 2 points. Section 3, the rating factor is only worth 16. So again, how do you divide up your narrative space? And one thing is you can't answer questions through attachments. You can strengthen and supplement, but HUD is not going to give you points for answering a question where you say, see Appendix B. That's not going to be sufficient to get your answer. So within those 15 pages, you have to make sure you've answered all the questions. And one thing we recommend is once you're done with your narrative, go through and look through pages 14 through 24, which are really the program requirements section. And ask yourself, have I looked at all those sections? Have I answered all the components that HUD says this is a highly quality, successful application is going to address each of those things? So again, that's a pretty robust challenge for you, but make sure you do that once you've done your narrative. Some things are really important for the reviewers. They're able to follow titles for each of your staff, that you have the numbers the same, the number of housing assessments. So from number of applicant pool to assessments to units completed, making sure those things are all consistent, making sure your numbers are equivalent in terms of what's the HUD amount I'm asking for, how much am I bringing leverage, but across all your letters, your budgets, your forms, your attachments, a lot of times we see inconsistency, and that's just very difficult for the reviewer to follow. So again, those are things that are really important to get additional points. The appendices should reference the narrative factor. So again, on your attachments, make sure they tie back into your narrative as well. So that's important. Next slide, please. And a couple of last pieces to be aware of. It is a grants.gov electronic submission, as we mentioned. Make sure that your grants.gov is up to date. Make sure you've got several people who are authorized representatives, at least 2, who can submit on your behalf. And we really stress, don't wait till May the 4th, because you may have technical difficulties. So again, get with your IT person at your organization, with your city, county, state agency, make sure they've looked at this NOFA, you have the ability to submit through grants.gov because we sometimes encounter firewall issues, which we don't want to encounter at 9/20 on May 4th. So make sure you looked at these things up front. And even though the HUD NOFA through grants.gov does allow a 24-hour period to correct technical deficiencies, incurable deficiencies, those are not deficiencies in your application in terms of you forgot to attach a form or you forgot to include something. Those are technical deficiencies. So again, don't rely on that in that time period to be able to go in and fix and correct things. A curable deficiency is not something that actually will materially alter your application. It's just correcting something, a missing signature, a missing date. So again, if you've forgotten something, you want to be able to look at, it's a great system now. You can actually go and look at each item that's been submitted. You have the ability to look at your application once it actually goes in and verify all the attachments actually went through. So again, if you give yourself enough time to do that, it's important. And our last piece is once you've submitted, make sure you wait before you close up and pack up that you've gotten the validation email. So you'll get an email that says your application's been received, but also make sure it's been validated. That's the official verification that you're eligible. So we wanted to move on from that and also do a quick question and answer session. That we have a couple questions that have come in before we get to the chat box. Ruth Ann, do you want to read those? Do you want us to, who wants to?
Please. We have well over 100 questions, I think. So let me just say a couple of things up top. Number one, we will place this recording on our website and make this available to you, or you certainly can call us if there's clarifications on any of our presentation. The HUD staff will receive all of these questions for their answering, and they will be able to have these and also answer in alignment to the requirements of the notice of funds availability. I think that's incredibly important upfront. I did notice there were a number of really important questions around the occupational therapist, which is a new kind of aspect for some who are doing healthy housing work, and the cost and scope related to that OT. So we might want to talk about that. And if you want to tee up questions here, Wes, we can do that. But we had received a few questions in advance that I'll ask for HUD to help us answer, or have our team answer here. I think, if I'm correct, Peter, Yolanda, and Karen, you have struck the pre-application that is mentioned in the notice of funds availability. Is that right? So it's just
Yeah. So yes, that has been stricken out of it, and it's been an updated version of the NOFA that has been updated. So if, when it first came out, maybe like a week into it, if you downloaded the NOFA, the first week it was up, go back and try and download the new revised version. It takes out the pre-application portion of that. And also it has added the 10% admin cap to it. So you'll be able to go back and look at that in the NOFA.
great. Thank you so much. Something that we've gotten a lot is whether or not a clinic that is part of a university system, if they are eligible to apply either directly or as a sub-grantee.
They have to be a 501c. Universities are not eligible to apply for this grant. So they will have to be a 501c to be able to apply for the clinic itself.
Okay, and can the clinic be a sub-grantee or partner in the grant?
Yes.
Yeah, great. And then for Colleen, you're asking about where you can find the HUD opportunity zones. And you can look on the HUD website, and they have a great map of the opportunity zones. If you have any trouble finding that, we're happy to help you.
And I'm happy to send you the link as well, if you send it.
And if maybe someone could post the link here, that would also be great. Just going back to the pre-populated questions that we had received. For services in the rehabilitation repair column, in comparison to the maintenance repair column, now you can get down in the weeds. And by the way, Wes Stewart is the only person I know who can make all that regulation stuff seem good and sexy and wonderful, but you know, that's a skill. If in comparison to the repair column, when can grant program monies be used, and when can leverage funds be used for more major repairs?
They can be braided and used together. So if you are doing a unit, and I've seen, and some of the questions I've already seen, and most likely explaining this probably will answer a couple of the questions, Ruth Ann. So when you're using different sets of funding, the braid funding, we know that there's a $5,000 cap. We came up with that cap. We have to cap it somewhere to be able to effectively get money out and to make sure that units are being addressed. When you are braiding funds, you can use your CDBG funds, other leveraging funds. We don't have a cap on you using additional funds to be able to bring a unit fully up. We just have a cap at $5,000. If it's something that you want to address that's over $5,000, you just have to get pre-approval from someone on my staff who will be running, who will be considered the GTR, the government technical representative for the home mod program.
Thank you for that. I saw a number of questions around public housing, including that public housing already has program managers on staff, and they would need to hire specific program managers for this. So
they don't have to hire a specific program manager. The program manager that the Public Housing Authority can work, but they have to dedicate at least 50% of their time to work on this grant. So if you already have staff in place, they have to be able to work 50% of their time on this grant, and their salary can be charged to the grant.
Fantastic. And so I think that negates the other question, which is, can public housing agencies conduct interventions in federally assisted housing.
Hey, Ruth Ann, this is Karen.
Yeah.
I wanted to see if I could go back to the previous question and answer regarding funding sources and delivery of services and when and how and so.
1,000%. Thank you, Karen.
And I just wanted to piggyback on what Yolanda provided to us in terms of pre-approval for those particular projects where not only these grant dollars are going towards fixing, but also if you're using leveraged funds from other sources, that is considered in the environmental review world an aggregate project. So we consider for environmental review purposes all activities that are geographically or functionally related, and we consider all of those activities as a whole in terms of impact on the particular unit and resources, environmental review resources. So usually in a strictly maintenance activity or project where all of the funds are used for those activities are listed in that middle column that we referenced and showed a couple of slides on earlier in this presentation. If all of the activities for that particular project are in that middle maintenance category and section, then I don't get involved, meaning you don't have to come to me to provide additional information with respect to an environmental review. And it's a much quicker process for you and for me. So just keep that in mind. We're not saying you can't use leveraged funds or go over $5,000 with using other monies for the entire project. We're just saying that there's additional steps that need to be taken in order for you to implement that project. Thank you.
Thank you,
Yeah,
Karen.
Fantastic clarification. So I'm going to pick one question right here and then.
Ruth Ann, this is Peter Ashley. Could I just jump in real quick?
Of course.
This question about public housing agencies, I just want to make sure that response is clear. Public housing units would not be eligible to receive services under this grant program because they're not considered owner-occupied units. So I just wanted to make sure that was clear.
Okay, that is great. There's a question here in front of me about whether physical therapists can be substituted for occupational therapists. Do you want to answer that question? If they are trained to do home assessments, can physical therapists be in place of the occupational therapist?
This is Peter again. No, I think the training is quite different between those specialties. So now the physical therapist could say get a certification as a occupational therapist assistant. So that would be possible, but you couldn't just substitute a PT for an OT. Thanks.
So Michael and Wes, are there particular questions that are, we've got about 5 minutes left that seem to be of import here that we want to make sure that we get answered?
And Ruth Ann, whatever questions that are not answered here, Takia is on here. She's taking all the questions. We're going to do a FAQ. We're going to send it to you, send all the answers that we've answered and the ones that we have not answered in this. And you can post it to your website, and we're also going to post it to our website. Someone else asked, was this a grant that was coming from GHHI or from HUD? The grant coming from HUD, the Office of Healthy Homes and Lead Hazard Control office.
Yeah, we need to make super clear on that, and we appreciate HUD's role in making, and Congress's role in making this critically important. There is a question here on how does a small rural community with no previous relationship with HUD or experience with this program be able to use the program to address compelling need of its seniors and low-income residents? I think, you know, we're asking for 3 years of experience in the aging in place work, but they don't necessarily have to have a relationship with HUD, correct?
That's right, Ruth Ann.
That's correct. I'm sorry. I had you on mute.
Yeah. So Michael, Wes, do you have, or anyone on the chat pulling those up?
Sure, we know there's a rural and urban distinction, but Peter, is there also any regionality in terms of how funds will be dispersed and spread around to different regions? Or is it just highest scoring applicant? Will there be any consideration to regionality? No. One of the questions.
No consideration of regionality. Is a competition, so it's based on ranking of scores.
Mhm.
And on the experience aspect, we have an agency asking whether they can apply if they subcontract with a program that has 3 years or more of home modification experience.
Yolanda,
No, I didn't hear. I'm sorry, I didn't hear. Could you? say
I
it
think
again,
I can
Ruth Ann?
take that.
Okay.
I mean, I'm afraid that the NOFA is pretty clear that the applicant needs to have that experience. We have to be careful about saying, well, it's okay, you could have a sub that has that experience. We really have to stick with the wording, of the NOFA. So in this case, Yolanda, the question was whether the sub could have the required 3-year experience and not the applicant.
Yeah, it's gonna have to be strictly to what the NOFA states.
There's been a couple questions around sort of what fits within that $5,000 cap per unit. There's questions around does operating, admin, and indirect fit in there? Does the OT costs, do they have to fit in within that 5,000? So maybe if someone could.
No, the OT cost is going to be a direct cost, but it doesn't go into the actual work itself. So the $5,000 is for the work itself. You have an opportunity to add in staff with your 10% admin as well as your OT. Your OT will be considered direct cost based on the OT can be tied back to the unit itself.
Thank you. So I think we only have about a minute left, and I don't know, Ruth Ann, if you want to close or HUD partners.
Well, first, I just want to thank the HUD partners and again, ask people here to spread the word that HUD will be doing another webinar on this on April 4th. We'll share that to this network. I know there's lots of interest here. All of the questions that chat will go over to HUD and Takia Worthy will help to manage getting them to answers, and we'll post them on our website. We'll share them with all attendees. HUD will post them on their website. We appreciate the U.S. Department of Housing and Urban Development advancing age in place as part of the Healthy Homes portfolio. We thank everybody who participated today. We appreciate your input and let us know how we can continue to get this information out to the public. And we thank you and wish everyone great success in your applications. And I think if HUD could almost have $1 billion here and still be behind on the need and the interest in this program. So I was very pleased to see the robust interest here. Thank you all so very much. Thank you, Michael. Thank you, Wes. Great job. Thanks.
Yeah.
Yep, thank you. Thank you.
Thank you, Ruth Ann. Thank you, guys. Thank